Let's assume a scenario in which Obama is the next president of the United States. Yep. Nancy, there's one. Nancy Pelosi is the highest-ranking official in the House of Representatives. Harry Reid is the highest-ranking official in the Senate. And so, therefore, something very like his health care plan becomes the law of the land. Which of these options that you've talked about, these bottom-up workarounds, which will respond most positively to that, which will become more popular, what will spring up in reaction to that? How will that, I know it's a very difficult question, very complex, and there's lots of levels to it, right. But what is the dynamic in these sort of self-made healthcare reform plans, these experiments that are out there? How would they respond to the Obama plan?
They're not necessarily hurt by it. In fact, one of the things that I looked at comparing Obama and McCain is there's a very obvious hybrid available to them if they choose to use it. McCain wants to do interstate purchase of health insurance. Obama wants to do this insurance exchange. Obama's insurance exchange could easily be the mechanism by which McCain got his interstate purchase. Obama wants to do subsidies for the low income. McCain wants to do a tax credit. McCain's tax credit could easily be the mechanism by which Obama delivers subsidies. Obama wants to have comprehensive coverage, now, without really defining what that is. Now, actually, a health savings account is a terrific way of providing comprehensive coverage, because instead of having Congress picking and choosing whether they cover acupuncturists or dietitians or chiropractors, give people a health savings account and they will have coverage for whatever they want underneath some catastrophic deductible. And you could fund a poor person's HSA at 100% and a not so poor person's at 25%. So I think these things are taking on a life of their own, and any proposals that they come up with will have to work around this revolution that's already underway.
Does the revolution to some degree work around the new proposals? In other words, would some of these proposals push more people into these alternate systems where there might be more freedom?
Yeah, very likely, if it's allowed. Unfortunately, in Massachusetts, for instance, they said they were going to allow health savings accounts under their mandatory coverage. They have not, and that's a shame. But they're also finding the costs are going up so much, it's killing the taxpayers in Massachusetts. So they're likely to come back to this. Look, sooner or later, all of this is inevitable, because nothing else works. We've seen that all over the world. It's not working. Canada is changing its healthcare system because it's not working. Britain is changing its healthcare system because it's not working. Sooner or later, and I hope too many people don't have to die because of bad ideas first, we will get to consumer empowerment in healthcare and everything else.
I don't know how familiar you are with the Obama plan. This might be a Michael Tanner question, but is there anything about the Obama plan? How does it relate to health savings account, concierge service, cash-only service? If that's not something you've looked at, that's fine, and I'll see if Mike knows something about it.
Yeah, he doesn't address it, and frankly, I don't think Obama or McCain know or care very much about health care. That neither one of them is very detailed. Mike, you got anything on that?
Yeah, Obama in his book, Audacity of Hope, specifically rejects the idea behind health.
So the Audacity of Hope rejects the idea of health savings account. I assume his actual published plan is silent on the matter of health savings accounts?
Correct.
But he's been critical of it. I assume something like concierge service or cash only would not count as coverage in a coverage mandate. If he requires that everyone be covered, I assume that just the cash only deal with the doctor would not count as health insurance coverage.
That's correct. You have to buy both. You go outside.
I see. You have some insight on this? Right. The question is, because
Well,
people are watching at home, the McCain tax credit is sort of like an HSA way of looking at the world, because it's the individual's in control.
I hope so. I'm worried that the tax credit could be keyed to some particular kind of insurance policy. Like Michael was saying, you know, if you have a $10 million deductible, you're not going to get the tax credit. Someone has to define what is worthy of the tax credit when you qualify. But that's the point of the next 2 years of growth in these things. If we get to 20% market share in health savings accounts and HRAs, the politicians will have to pay attention to that, and they will not be taken away once we get a certain market penetration.
Question from the card: what is the insurance company's role with health savings accounts?
None with the health savings account itself. The role of the insurance company is to provide the high deductible coverage. They have no authority whatsoever with the health savings account or the money that's in it.
Why do 59% of doctors support single-payer healthcare system?
Because doctors are just frustrated. I mean, they are throwing up their hands. They hate the bureaucracy that comes with third-party payment generally, and I don't blame them. They should hate that bureaucracy because it's unnecessary. And a lot of them think that Medicare has a little less bureaucracy than private insurance does. I'm not sure that's really true. If you get crosswise in Medicare, it's not only a civil problem, it's a criminal problem, and doctors can be jailed for making a mistake on their Medicare billings. So I think a lot of these docs are not experiencing. A lot are not clinicians also. I mean, they're academics and that kind of thing.
And
I'm sorry?
he asks, does the health savings account eliminate the insurance company?
You have to have a high deductible health insurance plan to have the savings account, but the insurance company has no role to play whatsoever with the account itself. That is done through a bank, through a, I'm sorry? Yeah.
Well, I want to bring this conversation through the microphone, so because this is going out. He's asking whether the insurance company reimburses. The insurance company reimburses for the part above the health savings account. Right. So the part that's the health savings account you control, and then for the part above that, the catastrophic, then the health insurance company has a role in it.
Right. With one exception, which is that too many insurance companies like United Healthcare, the example I was giving you, are still trying to have some influence over the low-cost claims. And they're trying to reprice them, and they're trying to adjudicate them. And their argument is, if we do all that, we will save you money by lowering the cost of the service. But that is failing as an argument. And sooner or later, they will be back to only taking care of things that exceed $5,000 or whatever your deductible amount is. And the HSA itself is actually run by a bank, a credit union, an independent administrator. It has nothing to do with the insurance.